Well, more than 100 non-governmental organizations have released a joint statement demanding action to protect Palestinians. They say as mass starvation spreads across Gaza, our colleagues and those we serve are wasting away. Aid workers are joining the same food lines, risking being shot just to feed their families. The charities went on to urge governments to press Israel to open all land crossings, restore the full flow of food, clean water, medical supplies, shelter items, and fuel through a principled UN-led mechanism. They emphasize that states can and must save lives before there are none left to save. We're going to speak to Dr. Mohammed Abu Mughaisib. He's the Deputy Medical Coordinator for Doctors Without Borders, joining us from Khan Younis in Gaza. Dr. Mohammed, thanks for your time. Doctors Without Borders adding their name to this joint statement. What impact do you think this collective statement might have, if any at all?
Thank you for having me. Of course, we will try everything. It's not the first time that we were calling to not use humanitarian aids as a weapon. We were pushing for all the time, and it's not the first time, as I mentioned. The situation is really dramatically deteriorating in Gaza now. Everyone is facing starvation now. Acute hunger. It's not among only the population who are we see in the hospitals. No, it's among our staff as well. The medical staff, the paramedics, everyone is really facing the same situation. There is no food. People are completely exhausted, completely lost their energy.
Elaborate a little bit more, if you may, on the scale of the crisis. How would you describe it as starvation takes hold and shortages intensify?
Since March, since the break of the ceasefire, it's things. They didn't allow any food. To enter medical supplies. Isolation units in Gaza. Of course, the population. It's a young population. It's more than 50% of Gaza are young population. Children and they need not just even bread. They need real nutrition. They need food. They need eggs, milk. And this is not available since March. Now it's not about malnutrition among patients that we see. Yes, there is high number of malnutrition among children, among pregnant women, lactating women, but as well there is the population all. The people who are treating these patients are suffering from hunger. They're not able to feed themselves, the doctors and nurses.
So how is that, as well as the total blockade and the lack of access to essential supplies, impacting your ability as an organization to provide medical care to those, as you're saying, who are suffering from malnutrition and other related conditions?
Of course, there is a lot of items that needs to be, they are not coming. A lot of shortage of items, including the items or drugs or supplements, let's say, that we use in our clinics and hospitals to treat whatever is the disease. Surgical for trauma burn or malnutrition or pregnant women for follow-up. A lot of items are missing, and we were warning and pushing, and we hopefully that this will end, because in few weeks, if we will not be able to let enter these items, because we have to stop. There is nothing. We will be only here to do consultation for patients and not to treat patients.
So what's at stake for people in Gaza if the current conditions persist?
Whatever it continues or not continues, the population are, since the beginning of this war, are actually suffering. They are displaced more than 10 times from their places. All the population are squeezed in 14% of Gaza area. There is lack of food. There is lack of water, drinkable water. There is nothing. There is no shelters for them even. There's no space anymore for them to shelter. So the population are suffering. There is increase of a lot of diseases and infectious diseases in Gaza during this war. People are not able to, hospitals are not able to absorb the number of patients. The patients are in the corridors lying on the floor. Operations are done on the floor. There is no space anymore because most of the hospitals are partially damaged or completely destroyed because of this war. So we are asking to stop this war and to end it.
Okay, we will leave it there. Dr. Mohammed Abu Mughaisib, you're the Deputy Medical Coordinator for Doctors Without Borders, speaking to us from Khan Younis in Gaza this hour. Thank you very much.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.